So, first of all, let me give you a brief introduction. The patient comes in early pregnancy, or she comes in for the pre-pregnancy counseling. Very rarely they will be coming in the advanced pregnancy with some complication, right? So now in maternal medicine cases, in any of the scenario, when they come in pre-pregnancy counseling, when they come for early pregnancy, you have to tell them how the I mean, first you have to know what kind of disease it is, and suppose if some very different disease comes, then you can always pick the station. These are very easy to go stations, and you have to just see that just ask the patient typically about the onset of the symptom, duration of the symptom. Does she know what this disease means? So she herself will tell you what is the disease even if you don't have any idea. So by the symptoms you can make out that what kind of a problem it is, which system is involved in the problem. And then you have to ask the present condition of the patient, how much the disease is severe and how much it is affecting the woman, right? If it is controlled or not. And what medications, see, there are two three very important things which you should be knowing, that you should always be asking about the medicines. Safety of medicines is a very big patient safety domain. So medical safety, safety of medicines during pregnancy, during breastfeeding is one of the most important part. So in maternal medicine cases, you need to check upon the symptoms and disease severity, then come to the drug part, come to the medicine safety part and doses of the medicine. And then what about the other systems of the body? Is it involved or not? Then is it a genetic disease or it's a autoimmune problem? What kind of nature of the problem, right? And then coming on to any family history. What about if it is a genetic element is there, then what about her partner? And what about the previous baby? Is the disease running in there as well? Have they got the genetic counselings done? Okay, so this is the third most important part. So we have to just focus on the you can say headings, like we have to cover the topic under certain headings. So you will ask about the genetics of the disease, and then after that a general history of the pregnancy, like what advices now you what you have to ask from the patient, like how far she is in the pregnancy. Is she taking folic acid? Are there any indication of 5 milligram folic acid or high doses of folic acid? Are there any indications for the aspirin, and is she taking that? So those things you have to ask. What about her investigations? Any latest or older ones, or booking blood scans, booking blood samples, and the booking scans. So, for regarding this present pregnancy, if she has conceived before also, then you need to check that in the previous pregnancy, how was the control, and was the disease affecting her pregnancy throughout or during the delivery? Did it affect the baby as well, right? And these are the things you need to check about the past pregnancy. Okay, and apart from that, um, you need to check about her mental health, which is required for all women. Then the support at home, because she's having an additional medical problem, she will require it more. Then smoking, very important to deal with. Alcohol, any drugs, these are important. Okay, drug allergies we always have to rule out. If it is a bleeding distress, bleeding problems are there, then you need to check for the Jehovah Witness as well, check the blood group as well. Okay, so these are the things you are going to check with the patient. And then after taking the history will be a little longer in maternal medicine. So everywhere we ask that finish it in 3 minutes. Here we would advise you to finish it in at least, I mean, expedite, and maximum you can go till 4 minutes, right? Okay. So here it is. We are coming on to this. So I have divided it into disease. You will be asking about the history points, the symptom control, drugs, and if it is an unplanned pregnancy, ask about the contraception. And if she is planning for pregnancy, if it's a pre-pregnancy counseling station, then check for the good contraception and advise accordingly. Ask her to take the folic acid and check for the requirement of aspirin if it is required. Then some drugs in post pre-pregnancy counseling, you need to advise her. We will stop some drugs, we will change some, and may need to add some drugs. Okay, stop the drug or change the dose or add new drug. Okay, allergy you have to rule out first. In genetics part, if this is a genetic problem, family history, partner with same problem, previous child, what about the previous baby status, and book the appointment with the genetic counselor or geneticist. Then vaccines in some of the diseases like sickle cell anemia, thalassemia. These are the like problems which need in which we need to know the status of the vaccine. Now, coming on to the first case, that is from Lisa Joel, diabetes in pregnancy. I would advise you to divide it into two portions. Like, in portion one, we will be discussing the information gathering part and the examination part. So that part one person can take, and in second part we will be discussing the management of this, means applied clinical knowledge along with the safety and the communication with the patient domain. All three will be the most important parts, though it will be continued throughout the station. In information gathering, you need to check about the important history points, which includes patient safety, which includes the communication mainly. Okay, so information gathering should include the two main domains, that's the safety and communication. And applied clinical knowledge will be safety, communication, and knowledge. All three things should be there. So, who want to go for information gathering for this station and the applied clinical knowledge portion of the patient? Yesterday, some of you. Yeah, Bushra, sure, Bushra. Go ahead. I just would put the timer here, okay? And you are good to go.
So how much I have to cover, ma'am? Information gathering and
Yeah, and examination,
examination.
right? So,
Okay.
okay, you can start, Bushra. I have put timer here for 10 minutes, right?
Okay.
Nice. Just a minute. Yes, hi, Bushra. Yeah, please start.
Yeah. Hello, I'm Dr. Gupta. I'm one of the doctors in the antenatal clinic today. Can I confirm your name and age, please?
Yeah, I'm Olivia Deborah, and I'm 35 years old. 37 years
How
old,
may
sorry.
how may I address you?
You can call me Mrs. Stone.
Mrs. Stone. Okay. Okay, Mrs. Stone. I gather information from the letter written by the GP that you are you are 10 weeks pregnant and you have a medical condition called diabetes, and you're
Yeah,
here to discuss about that.
yes.
Am I right?
Yeah.
Okay. Are there any more concerns or expectations from today's consultation?
Uh, no, doctor, it's just that I want to know that my sugars are, going very high nowadays, and sometimes it's normal as well, like it's under control, but sometimes it's becoming higher. Doctor has asked me to monitor my sugar levels. GP has told me that. So I'm doing since I'm pregnant now, it's been 10 weeks, but I can see
Mm.
that, levels are higher than the limits they've told me. So I'm a bit worried as well, and I want to know that how are we going to manage it in pregnancy? Shall I increase the dose even more?
I'll be addressing your concerns, Mrs. Stone. But before that, is it okay if I ask you a few questions?
Yeah. Okay.
Yeah, okay. So, can you tell me more about your condition, like when you first got to know, and then how it's been so far?
Yeah, it's been 10 weeks now. I went to the GP 2 weeks back because my periods were a little irregular. So I got to know just 2 weeks back that I'm pregnant. As it the period, I thought the periods are usually delayed by 1 week, so they can be. But GP said that I'm pregnant. So if my dates are like right, so it can be 10 weeks of pregnancy by now.
Okay. I see that it is an unplanned pregnancy. What are your thoughts on the pregnancy?
Yes, actually, we weren't planning, but it go like if it is how it has happened now, we are happy with it.
Oh, that's lovely. And can you tell me more about your condition, about the diabetes?
Yeah, it's after the delivery of my first baby. Yeah,
Okay.
she yeah, I delivered her. I think 8 years. She's 8 years now. So
Okay.
after that, by the next year, when doctor told me to, check the sugar levels because I had this diabetes during the pregnancy, right? So when we checked that, went for the checkup, so in that I was diagnosed that I have developed diabetes already. So they have put me
Mm,
on this drug, what we call it as metformin. Yeah. So metformin
okay.
I'm taking morning and evening. So so far it was good, but now it's
Okay.
getting yeah, person.
Yeah. Can I ask you, when did you meet your specialist doctor last time?
I met him 3 months back.
Okay. And when did you had your checkup with the eye doctor?
Um, that was I think almost a year now.
Okay. So I see that you have been taking this medication,
Mhm.
which is metformin, and you are taking 1 gram 2 times a day.
Yeah.
Uh, but the control seems to be poor.
Mm-hmm.
Uh, so that is why for this, I would like you to be reviewed by the specialist doctor so that we can adjust your medication.
Okay, sounds good.
Okay,
Yeah.
okay. And are you allergic to any medication?
No, not as of now.
Okay,
Yeah.
okay. Any other long-standing medication you have been taking?
No, doctor, just the folic acid GP gave me.
Okay. And how much dose are you taking folic acid?
And that's something I think 400 micrograms.
Okay. So I'll note it. Actually, in this condition, we need to increase your dose to 5 milligrams. Okay.
Okay.
So
Yeah.
I'll tell about that in detail again.
Okay.
And did you had any booking blood test?
Yeah, the counts have been done. Yeah.
Okay, okay. And any dating scan was done for you?
Um, no, they have sent
Okay,
me here for that.
okay, okay. So, in your family, does anyone have a history of clot, blood pressure, or sugar?
No.
Okay. Any surgeries done for you in the past?
No, doctor.
Okay. And you told me that you have a daughter. Can you tell me how was the pregnancy and any other problem did you have during the pregnancy?
No. I developed the sugars, but those were controlled on the diet itself.
Okay.
Yeah.
Okay. What was the weight of the baby?
Baby was 3.5.
Okay. Any problems during delivery?
No.
Okay. How was your recovery after the delivery?
It was very smooth and good.
Okay. And I see that you smoke 10 to 15 cigarettes per day. Let me tell you, Deborah, that smoking is not, uh, I mean, smoking is harmful to you and your baby. Uh, uh, have you ever thought of quitting smoking?
Yes, doctor. I am really trying hard. No. Uh,
Okay.
I know that I will be said this because I've come for the appointment, but I'm really working very hard on that. I was having even more, you know. I was a chain smoker, but now I have reduced a lot. And for the
Yeah, I
pregnancy,
can
I'm
connect.
really worried.
Yeah, I can connect you to NHS Stop Smoking Service, and they can help you with that.
Yeah, okay, yeah, that would be great.
Yeah, I also see that you are slightly overweight. Okay, so being overweight in pregnancy can have a lot of problems for you and the baby. Um, uh, uh, I can connect you to the dietitian or to the weight management team if you would like.
Yeah, okay.
Okay. And, what do you do for living?
I'm a teacher.
Okay, and are you well supported at home?
Yes, doctor, my partner is really very supportive.
Okay. And for the last 1 month, have you been feeling down or depressed?
I'm worried. I'm a bit stressed. No, I'm a bit stressed about the condition which I'm going through.
Yeah, I'm understanding. I understand, Deborah, your concern. But we are here to help you. We are here to guide you, and even we can even connect you to the counselor, and maybe you'll feel good when you speak to her.
Okay.
Okay.
Yeah. Thank you, doctor.
Mhm.
Okay, shall we hi ma'am, shall we continue with the management?
Yes,
Okay.
please. Hmm.
Uh, Thank you, Mrs. Stone, for sharing this information. Uh, if you, with your consent, can I just examine you in the presence of chaperone? My nurse will be taking your pulse, blood pressure, and I'd like to have a look, feel of your tummy. Is it okay?
Okay.
Okay, thank you. Okay, Mrs. Stone, coming to your condition, this, you have got you're 10 weeks into your pregnancy, and you have a condition that's type 2 diabetes mellitus. So let me tell you that many women with this condition, they manage to have a healthy pregnancy and have a healthy mother baby outcome. However, we need to have it under control and to take proper care of it. Am I clear to you?
Yeah.
Yeah. So your care will be onwards with a specialist team of doctors, which you call as MDT. It will involve our consultant obstetrician, it will be a diabetic doctor, the diabetic nurse, the dietitian, exercise doctor, the sleep doctor, and the GP. Okay.
Okay.
Yeah. Yeah. So relating to its effect on your pregnancy, in women with diabetes, there is some slightly high risk to the baby in terms of miscarriage if not properly controlled. and there may be increased risk of congenital defects in the baby, which may be cardiac. And sometimes there may be increased risk of a baby growing larger in size, which we call as a macrosmia. All right. So for these conditions, we'll be taking care of you, and we like to have in addition to the booking scan at 10 weeks now, we will go for an anomaly scan at 18 to 20 weeks. So in that, we'll also have a look of the heart of your baby. All right. And
Mm.
also from 24 weeks onwards, we would like to have a serial scans of the growth of your baby. Am I clear to you?
Yeah.
Yeah. So relating to the mother, there is a risk that the disease, that can worsen in terms of some slight risk that your eye problems may get aggravated. So as you can see that you have visited your doctor last 1 year before. So we like to have a visit to your eye doctor for an eye checkup. If it happens to be normal, then another eye checkup will be done at 24 to 28 weeks. Okay.
Okay.
Yeah. Yeah. And also we'll be doing some tests for your well-being to know about your kidney function and your blood glucose levels. And accordingly, as per your blood glucose levels, we will be initiating the insulin that will be done by a diabetic doctor. Okay.
Okay.
Yeah. And Mrs. Stone, you need to have a regular check on your blood sugars, okay? And have a regular visits to the Joint Diabetic at ANC Care Clinic at 1 to 2 weekly. Am I clear to you so far?
Okay.
And do you have any questions till now?
Doctor, can I delivered naturally in my last delivery. So
Yeah.
what about my delivery? Will that be like
Yeah.
vaginal or cesarean?
Yeah. Relating to that, your previous pregnancy was a normal delivery. Yeah. So we will have a plan, we'll have a meeting at 32 weeks around, so that we will decide about the plan of delivery. It will include the sleep doctor also to know about the pain relieving options. As such, as this condition itself doesn't pose any problem to the normal delivery. However, we'll be assessing your other risk factors. Sometimes there is increased risk of developing hypertension in this condition. So depending upon your condition at that time, we'll be deciding about delivery. If everything is fine, you can go for a normal delivery. Okay.
Okay.
Yes, and mostly in this condition, we suggest the labor to be started by, delivery to be completed by 37 to 38 plus 6 weeks. So we'll be reviewing your condition at 32 weeks and taking the decision accordingly. So once, if there's a normal delivery for you, it should be in the hospital setting in the consultant-led care, and there will be the continuous monitoring of your baby. Okay, because these babies sometimes there is high risk of labor going longer, and sometimes can be difficulty in the delivery of the baby or the baby shoulder getting stuck, which we call as a shoulder dystocia. So for that, you need to be in the hospital so that the maneuvers can be undertaken. Okay. Yeah. And we'll be also continuously monitoring your glucose levels during your labor. That will be done, every hourly. And we'll be sometimes using the drip with the insulin if needed and decided by the diabetic doctor. Okay.
Okay.
Yeah. There may be also some risk of, increased injury to the, birth passage. Okay. Due to the large size of the baby. And sometimes we may require assistance in the form of applying some instruments. However, it's recommended if sometimes the baby weight becomes more than 4.5 kg, then we may be deciding you or offering the option of cesarean delivery also. That will be only with your consent and wish. Okay.
Okay.
Yeah. Yeah. And in order to decrease your risk of bleeding, okay, post delivery, we may require to give you some, hormone drips, which will just contract the womb and help in the, reducing the bleeding. Am I clear to you?
Okay.
Yeah. So after that, postnatally, these babies are at high risk of developing low glucose levels. So we may need to, baby will be seen by the baby doctor, and the blood glucose of the baby will be monitored accordingly. And also, we'll require after delivery, will assist you in breastfeeding that needs to be initiated within 30 minutes and will be supporting you with the breastfeeding nurse. And also contraceptive advice will be given to you, and your dose will be reviewed by the diabetic doctor. Okay. Have you
Yeah.
any questions? Have you any questions till now?
So
Or
for
you
now,
want?
when the controls are not so good,
Yeah.
so I need not to worry about what is the next step like for.
Yeah, you would need to have a good control of you, and for that, we'll be also going for a test that's HbA1c, and also we'll be connecting you to our specialist doctor, the diabetic doctor, so as to review your medications. Okay, and also we need to take care of your diet as well as the exercise, which may help in reducing the blood sugar levels. And also we'll be giving you some ketone strips if sometimes you feel excessive thirst or increase you need to go frequently to pee, then you can perform this test to know about a condition which we call as a diabetic acidosis. And Mrs. Stone, this I'll give you written information about that. That is a serious condition, and that very moment, if it happens to be positive, you need to come to the hospital. Okay. And have any questions, or you want me something to repeat?
No, that's fine.
All right, thank you. I'm giving you this written information and also connecting you to a diabetic specialist doctor, giving you appointment with our consultant, and I'll be documenting everything what we have written and booking you for a scan and the test, and I'll be writing back to your GP. Thank you so much for seeing.
Okay. Yeah, thank you. Right. Both of you did very well. I'm happy. But there are a few things which are to be urgently addressed as the exams are ahead, right? So Taskin, you're Taskin, right?
Yes, ma'am.
Okay. Hi. So your voice is really very good. The way role players like, they don't want you to be loud and fast. They want you to be empathetic and a low tone voice. So you have that. That's a good part. Plus, there are certain things I would like to tell both of you. So, what we will do now is we will be going along with the templates and we'll be telling you, correcting you also that where you were missing what, right? So, that will be easier, I think, and it will be having an impact also because I don't believe in correcting so much. I think that you should know the right thing and correction comes itself by itself. It will not come if I will continuously telling you, you're doing this thing wrong. Here you should say this, here you should do that. No, you have your own style, own way. You all are doctors and you know how to connect with your patient. We all are different, we connect differently. So just you have to include all the points, all the patient's safety points mainly, and you should be having a good communication skill. So patient safety and communication, they are the two critical points here for the whole examination part. If you are having a good communication and you are a safe doctor, that's the best thing that that can happen. So you are a very good candidate for this exam and you can pass in one go also, and it's easy to pass in one go. It's not that difficult, right? So let's start with the history points. As I have already told you that the history of the present illness and the control are important. So depending upon all the scenarios, like now she is a diabetic woman, okay? So you have to see about the medicine, which is already written since when you are having the problem. So in this, make it sure that you are asking about the past clearly, about the past admissions, about the past complications also, right? So you need to check with the woman that did she ever had any hypo episode or anytime she need to get admitted because of the sugar, uncontrolled sugars or over controlled sugars, right? So that you have to ask. And So Bushra, you were lacking that you didn't ask about the
Yes.
admissions and
Ex-
complications in the past. You did ask about the specialist, like when did you meet the specialist? Um, did you discuss whether after you can get pregnant, or on these drugs, or did you discuss anything about the pregnancy plans? But as she said, I am unplanned pregnancy, so you can skip that question automatically. And then you need to check that is she compliant with the medicine, right? She is having uncontrolled diabetes, so you need to check whether she is taking the medicine regularly. So first question should be, oh, I see, she said that my sugars are going high. Oh, I see. So are you regular with your medicines? Just ask there only. Are you regularly taking the medicines? How are you taking it? That also you have to ask, you have to check that. Okay, is she taking it 15 minutes before meal, or she's taking like anytime, so that matters. So you have to check, how are you taking the medicine? Okay, I see. And what about, are you monitoring your sugars frequently or regularly? Okay, so before pregnancy, was it all settled? Yeah. Okay. And what about your diet? Did you have some dietary changes since you're pregnant? Um, no, I'm taking the usual diet. Oh, okay. And is it a diabetic diet? Have you consulted any dietitian till now? Right? You may offer her first line of management is diet. Okay, for 2 weeks, diet control is the first line. So you have to ask about her diet change also. This is very important because she's asking you that my sugar levels are going up and down, like they are more, and sometimes it's normal, but sometimes it's more. So is she skipping the medicine? Is she having dietary changes? And then what about your work? Are you more stressed at your work? Yeah, and any outings? Okay. And when did you meet your eye doctor? Have you got your kidneys checked in the recent past? Okay. Any hospital admissions? What about your appetite? Is it like, is it okay? Is it increased or reduced? What about your water works? Is it like any frequent water infections? Okay. Because that will also give you idea whether it is getting really uncontrolled, right? Yeah. And it's, you need to pay attention. So did you have any clots problem or any high blood pressure in the past? Okay. Any surgeries in your family? Anybody has sugar that you asked? Very good. So you have to ask about the drug allergies. Do you have any drug allergies? What about your blood group? Any reservations to blood? Because in diabetes, she is at high risk of having PPH also after delivery. So you need to check that. And because of the macrosomia also. So Jehovah Witness need to be asked in the first visit. Then coming on to previous pregnancy, you've asked too much in detail, and that was very good. You asked about the weight also, difficult delivery also, and any complications also. So family history of sugar, blood pressure, clots you asked. Then smoking, alcohol, and drugs also you need to ask. And do you take alcohol? She'll say yes. Okay, we advise you not to take it. If she says yes, okay. And for smoking, first, always it is a good idea to check with the person that are they doing something about the problem? Do they know that it's a problem? So for the smoking, when she says I smoke 10 to 15 cigarettes, oh, that's a lot. So do you know it's not safe to smoke this much in pregnancy? Um, yeah, I know that, and I'm trying a lot. Oh, that's very good. I appreciate that. So, if you need our help, we are there. Yeah. And there are very good stop smoking services by NHS. Have you ever taken help from them? Because she said that I'm taking help. Then just ask whether it is the same. She'll say no or yes, whatever is the answer, reply accordingly. That's very good. I would advise you to be consistent with them or join them if she has not joined. Okay. Mental health, you asked. Social, you asked about this thing. The partner is very good. BMI is 36, so it is obesity class 2, right? You said you're overweight. So she is obese class 2. So that you need to be.
Yeah, but for patients, will understand like, or if we tell overweight, that is
No,
fine.
no. Overweight is overweight till 30 overweight. And you
Okay.
have to tell her that, the weight, the BMI range which you have, it comes under obesity grade 2. That's something this grading has been done by bigger research bodies, like it's a WHO classification, right? So they says that in obesity grade 2, there are some complications that can happen. You have already developed sugar, your sugars are already getting uncontrolled, and that can also lead to high blood pressure, some lipid imbalance also. So some metabolic problems can also come up. So as a whole, it affect your general health also, right? So we advise you to have a control on this. Not during pregnancy, we will not advise you to have a weight loss, but yes, to maintain a healthy weight. That's advisable. So, what are your views about it? Yeah, okay, that's I understand that. Yeah, so I can put you in touch with the dietitian, which will help you to have your diabetic diet also in a perfect way. They can plan your diet, and some group exercises also are there. Um, some exercise groups are also there, so you can join them to be consistent. Otherwise, it has been seen that the main problem comes is the regularity. So when we are not consistent, so things come back again, and groups give us motivation too. So what do you think? Keep on, just be very casual, and give the right advice, right wordings, and that's it. Okay. So yeah. So that was my this information gathering feedback. You have almost asked everything. Just few things which, water infections you can ask about, the UTIs you can inquire, yeah, to see whether it is really, the levels are really bad in the recent past. Okay. And that's all. She is on medicines. You asked about drug allergies also, and that was good. Now, coming on to the examination part, very well, Taskin, you have told that I will do the PA. She's obesity grade 2. You won't be able to find anything. And in so early pregnancy, need not to do PA, okay? Just say relevant things. I would like to, I will ask my nurse to examine your blood pressure. Will that be fine? Yeah, okay. And now here you have to deal with two problems, girls, in applied clinical knowledge. It is a diabetic station as well as it is an obesity station. Okay. So obesity also you have to deal. She's obesity grade 2, 36. That's quite a lot. So you have to tell the obesity complications also to her. So, okay. So I can now let's start. I will take you through, and Bushra, one very important thing, when you started interacting with me, you did not make the agenda. Agenda making is always better because it summarizes your station and and give a clarity to the patient that what they can expect out of you. Yeah. So you can say, I can see whatever you can read through that template. Just read it in your paper, make 4, 5 circles and write important points about. First, write the age, okay, and name. In the second circle, write the history points, what important points you need to cover, so that you do not forget. Like in diabetic station, you need to ask, right? You have to ask the present illness problems, and is there any point like BMI has been given, so you have to write the BMI also in circle. You have to write smoking also in circle. You have to write uncontrolled sugars also in circle, so that now in history of present illness you have to identify these things. Okay. And then in applied clinical knowledge, make another circle, and then you write there that which issues you have to address. Smoking, either you kill in the you know you tackle it in the history and manage it there, smoking point. And to the obesity, you have to get it into the applied clinical knowledge, and the uncontrolled sugars, get it into the applied clinical knowledge. Okay. So tell her that there are certain, I will be asking few questions. I would also like to check the blood pressure, and we will send some investigations that those are required for the pregnancy. Okay. And also I will write down a scan to you for saying the baby's growth. Apart from that, I would be after that I will take you through the journey, how you will go, how we will manage you during the pregnancy, during the labor or delivery, and after that. I'll just take you through that journey. How does that sound? Yeah, that sounds well. And in the end, I would also inform your GP and communicate with the GP, because when you said that, we will increase the dose of folic acid, that's a good safety point. But another safety is documentation also. So you do it there only. I will also document in your notes and communicate with the GP so that he will write the prescription for you. 5 milligram, though you can also write, but next prescription he can write 5 milligrams. Okay. And are you on any aspirin? Has he started you? No. Okay. Just ask aspirin also, because she is obesity grade 2 and diabetic also. So you have to start her aspirin and 150 milligram of aspirin, right?
Yes.
So there are certain risks when you're pregnant and you're diabetic. Yeah. But let me reassure you first that when you're pregnant and your sugar controls are very good, and the disease is controlled, the chances of having a healthy pregnancy and a healthy baby are very high, right? Most of the women, they they go through it nicely. But there are certain risks which are associated with the mom and the baby. So I'm going to explain it quickly to you so that you know that these things may happen. Also, along with that, the BMI, which is on a higher side, there are certain risks. I would also like to you to pay attention towards that. Okay. So like in the now till 12 weeks, in the history part, you should ask, do you feel sick also? It's in 12 weeks, you need to check about the nausea and vomiting of pregnancy also. So when you're having this nausea and, vomiting, so the sugar control become a little tricky. So you need to be more regular in measuring the sugar. Also, if the sugars will remain higher, that they may worsen the eye and kidney condition. So we need to get a checkup for you. I will arrange that, don't worry. And for the sugar controls, I would put you in touch with the endocrinologist and the diabetic doctor, your sugar doctor. And also as the pregnancy advances, it put you at a risk of having preeclampsia. That's the high blood pressure during pregnancy, and proteins in the urine also started coming due to the sugar when it affects the kidney, right? So this thing can also come. And as the weight part is also there, so this also adds up in all these things. Okay. And sugar level also can
So it will be like the combined
become,
diabetes and obesity. Like two, we have to discuss, right? Combined.
yeah, combine it.
Yeah.
Because see, if you feel it for yourself, like if your real patient is sitting in front of you, and you are in UK, and how would you, any patient, I say, if he or she is a layman, how would you explain them differently, different things, and too much? Just superficially, you have to cover this in a very simple language. The high BMI also adds into all of this, adds into the high blood pressure. The sugar controls become even more
Anesthesia
erratic.
complications. Mm. Anesthesia complications.
Yes, that we are
Then
coming. Yes,
thing and handling for that.
yes, yes. So just say that, the clot problem, yeah, blood become thicker once you're
Mm.
diabetic. And as such, pregnancy causes it thicker. Apart from that, the high BMI, this adds on. It adds on to this. So it makes you even more prone for developing clots. So we assess you for the risk. And then sometime we may need to put you on the blood thinners, right? And we advise you to be active and try to be active. as much as possible during the pregnancy and after the delivery to reduce the risk of clot formation. And also we also will be doing the risk assessment, right? And apart from that, when you will be going for delivery, where we will make a prior plan for you, as the BMI is on a higher side. So we need some special instruments and equipments and beds and chairs. So that we need to arrange before you come to us for the delivery. And the whole team will be there to take care of you. Throughout the pregnancy, there will be a multidisciplinary team which will take care of you, your conditions, and we will together manage you. So we will make a plan around 32 weeks of your pregnancies, say in the last trimester, and there we will decide like what role will be given to whom. Anesthetic doctor, that's the they will decide for your pain relief and for your this thing uh, when you will come for delivery, then which kind of a pain relief will be given to you. And if you go for land up in the cesarean section, if any indication will be there, only then we'll do the cesarean section. Otherwise the plan for vaginal delivery will be made, that too in a consultant led unit, right? And a team of doctors will be there to take care of you, because these two conditions, they make you prone for having and continuous monitoring will be done throughout the delivery. um, these two conditions together make the delivery a bit difficult. Baby may stuck, because baby may grow bigger during the pregnancy. So for that, you need to be in the hospital. We need to take some measures which are quicker, which we need to take quickly. So, and sometimes you may need blood also due to heavy bleeding after the delivery. So these are the things which we need to tell you, that these things can come up, and we will take care of all of these things as a team. We will advise you to come very regularly for follow-ups during this pregnancy. There will be some serial scans offered to you due to the diabetes. Apart from that, due to the high BMI, which may make the abdominal examination difficult, you know so that may become difficult. So we will be doing more ultrasound examinations. Okay. Baby, if we talk about the babies, that bit higher increased risk of miscarriage. Sometimes some birth defects can also come up when the woman has diabetes. Don't say that in your baby, in you. Don't say this, okay? Babies who have diabetic mothers, in some of them, some birth defects can come up, which can involve heart and spine. um, we will be having a scrutiny on that through special scans. One will be done at the end of the third month, and another will be at the end of fifth month. We call it anomaly scan. So baby may become big sometime, and may become smaller as well if the blood supply is hampered in that situation. So during the delivery, birth injuries can happen, but to avoid that, we will try our best, and we will be continuously giving you one-to-one care when you will come to the hospital. Um, preterm baby may come early as well sometime due to the obesity um, that can happen. So that's all. And these are I have combined the risk along with the treatment, or along with the points of management, that how we are going to manage you. So here I have written it in a summary, that you will be delivered in a consultant-led unit. Team of doctors will be there. Your diabetic doctor will also be there. Your GP will also be there. Our consultants and specialist doctors and specialist midwives and nurses, right? Folic acid 5 milligram will be given to you. Aspirin also we will start you on a small tablet, that's of 150 milligram aspirin, to reduces the risk of developing high blood pressure during pregnancy, and also the growth restriction in the baby. And in as your controls are not good, we would advise you to take a proper diet consult and have a diet control, good diet control. And the diabetic doctor may start insulin on you, right? That will require additional visits, regular sugar checkups, and serial ultrasounds we will be doing to see the baby's growth. And apart from that, your GP will also be communicated regarding your progress every time. We will be documenting our discussions every time, and you will be offered the testing strips sometime to test your sugar levels at home if you don't have it already. But as you said, you have already, then it's okay, right? Sometime you need to increase the frequency of the sugar monitoring in between, and a strip of ketones also. Don't pull it on. I think this ketones part we can reserve for type 1 diabetics, okay, who are already on insulin. As such, she is taking only metformin, that too twice a day, so we can manage her. So it is not a mandatory thing to give ketone strips and checking for ketones every time and saying so much to the patient, right? Just cover the main headlines of everything which is the possibility, okay? Then keep on asking her, am I clear to you? Does it make sense to you? Okay. Are you comfortable with that? If I put you with the counselor, do you want the counselor to help? Like she said, she is in stress. Then you can just, rather than providing her, there are good counselors, I will put you in touch with them. She doesn't want that. Nobody want that. Okay. Nobody, I mean, sometimes she said, I'm just distressed, I am having a stress. Okay, just ask first, do you need the help of a counselor? We do have good counselors. Yeah, because sometimes talking to somebody, they help you more. No, I'm okay. Okay, in future if you require, it's okay. Otherwise we are there to answer all your queries and questions. We will try our best to de-stress you in our next appointments, in our every appointment. Okay, so you have to tell that also to the woman that you are there. All right. And then because what do you think, guys? Like that is isn't it should be the way? Like you should ask first whether she want or not. If you are going through a flow, everyone, all the aspirants, whoever are preparing right now, they are having the same set of things in their brain, same set of questions and same set of lines. So, but they are not okay, right? You cannot give them your decision, like what you want for them. Everything you ask the patient, would you like to get this? Do you want me to do this? Okay. Do you want me to help? Do you want the counselor to pitch in? Or do you want this person to help you? Sometimes they are so self-sufficient or okay in themselves that they don't want that, right? So just she has a very supportive husband. So she may not want it. So though it's a small thing, but you should be preparing yourself in a very natural way that it should come out spontaneously from your mouth, right?
Yes.
Yeah. So in the history point, in diabetic stations, whether it's a type 1 or type 2 diabetes, always ask about the hypo episodes and tell her about that. If a doctor will put you on a higher dose of medicine, or your medicine will be titrated, or you will be shifted to insulin, then you must have glucose containing, sugar containing drinks and tablets in hand with you. Apart from that, there, because sometimes glucose may come down suddenly, and if you are alone and in a rushy place, then it may become difficult for you to manage. So always get to know your own symptoms of sugars getting down, and you will start feeling a racing heart, palpitations, and tremors and sweating. At that time, just pop in your sugar tablet or sugar drink, right? So it's a suggestion. Otherwise, we will also talk to your partner and tell your partner about the injection that can be given if you have a dizziness after the this hypo episode, right? So that I'm talking about the glucagon injection, because she can't inject once she's faint. So you have to talk to the partner, but you can in especially in type 1 diabetes, when she's on already on insulin, tell her that this hypo episode may happen. You should have sugar drinks. Your partner, we will tell your partner that how to give that injection to you. Okay, and apart from that, a dietitian you have already offered, so that's done. So sugar charting she will be doing, induction of labor for women with diabetes who are on insulin. That induction will be doing between 37 to 38 weeks, right? So you have to tell, we may need to deliver you a bit early depending upon the treatment you are taking for the diabetes and depending upon your sugar controls. No need to see if you forget some figures of some weeks and this and that. Just give an idea. At that time, we'll be doing this, right? We may need to deliver you a bit early. Like if you remember that, yeah, in NICE it is 37 to 38 weeks. Okay, then say it. Okay. If you forget also, don't mind. And but if your sugar controls will be good and the medicine, only medicine will be there, you can go in natural labor as well, right? And um, that's all. If some complication will happen like high blood pressure or baby growth problems, then we will advise you to deliver early. But that plan we will make together at 32 weeks. And if late complications will happen, we can change that plan as well. Okay. And after the birth of the baby, um, we will check you. We will help you in breastfeeding the baby. We will check you for the clot formation, again assess you for that, and a good contraception will be provided to you, will be advised to you in the follow-up visit, so that to avoid these kind of unplanned pregnancies. Yeah, so that we to avoid the unwanted pregnancies. And also after the delivery, we'll again advise you to make some lifestyle changes to have a better control of sugars. And we will also put you in touch with the specialist doctor to change the doses or the drugs which you are taking throughout the pregnancy. Okay. So this I'm telling you for making you understand that you have to approach it like this. Okay. And this should be on your tips, like what all you have to cover during your station. Any question?
No.
Am I clear so far?
Yes.
Okay. So you guys are doing good. I'm happy. Bit of changes you have to make. This is the high time. You should be very quick. And, this 1.5 months, you should be studying, like doing the station like day and night. You have to speak to yourself in front of the mirror, sleeping, waking up. Just remember the taglines. Just remember the safety points that, okay, in diabetes station today, I've realized that these are the safety points. Okay. So after the delivery, we always have to do the this contraception counseling, clot reassessment. Okay, ABC, the assessment for the clots, assessment for the no advice for the contraception, and help in the breastfeeding. Okay.
Breastfeeding, yeah.
Yeah.
Ma'am, about like some patients are nowadays on insulin that pumps subcutaneous. Ma'am, can you tell more about that? What
Yeah.
she has to do during that
Yes.
pregnancy?
So that's quite a topic you asked, and I want to. Okay. So what we will do? Insulin pumps are like they regulate the sugar. They monitor the sugar and regulate the sugar, right?
Okay.
So if some woman is on insulin pump and the sugar levels are well controlled, so in diabetic patients you don't have to do anything. It is for the operative thing what you are asking me, right? If she's
Yeah.
suppose if she's on insulin pumps, so the changes has to be done according to the trimester, so that the specialist doctor will be doing. Okay.
Okay.
Okay. But there is a information leaflet on that, and I
Okay.
will
We'll
be discussing in maybe tomorrow, or after that I'll make a video or reel and send it to you. Okay. So
Okay.
you,
Thank you.
I know what you want to ask, but I am in a hurry, so I don't
Okay.
want to go in detail of this. So
All
I
right, ma'am.
bring it to you because we have one whole station left. So we'll be doing that, and I will be covering this infusion pump for sure, right?
All right. Thank you, ma'am. Thank you so much.
And I want to take one coming on to the second station. Um, there, you guys are only three, but where is the another one who wanted to do the stations? There was one more girl who gave her name, but I can't see her here.
Yeah, two more girls were there.
Javaria was there, and Masuma.
Yeah.
Okay, so anyone else who want to perform? Iman,
Mm.
do you want to do? Or both of you can also do, Bushra.
Yes, ma'am. If no one is there, we can.
Yeah,
Yeah,
sure.
I and Dustin can switch.
Yeah. You can read it. This is the only slide we have.
Okay.
Yeah.
Shall we start with the history taking, information gathering? Yeah.
Okay. Taskeen can start with the history taking, and you can do the clinical knowledge part, discussion part.
Yes.
Oh wow, oh God, I have already opened the answer.
Okay.
Shall we start, Taskeen?
Yes, ma'am. Okay.
Yeah, do start, please.
Okay. Hi, I'm Dr. Taskeen, one of the doctors here today. Can you just confirm your name and age, please?
Yeah, I'm Olivia, doctor.
All
And
right,
I'm
Olivia.
27. Yeah,
Okay. Is it okay if I call you Olivia?
yeah, that would be great.
Thank you. Olivia, can you tell me in your own words how may I help you today?
Actually, doctor, I'm pregnant. GP has told me that, and I have developed some thyroid issues. You know, a year back, almost an year back, and I'm on some medicines for that. And doctor, though I was taking a low dose medicine, but before a month or so, I started having these tremors, and my heart was racing like anything, and I was sweating all the time. So I went to my doctor, thyroid doctor, and they increased the dose and changed the medicine. Though they said that my thyroid test was normal, right? So
Okay.
yeah, but I'm really worried that now as I'm pregnant, um, though we didn't plan this pregnancy, but we are very happy to welcome the baby at this point of time. At the same time, I'm worried that the tablets, the medicine which I'm taking, that can harm my baby. So I have
Right.
stopped the medicine a day before. The day I got to know, like my GP told me that I'm pregnant, I stopped the medicine. But now
Mhm.
again, in the day I'm having palpitations and tremors every now and then. I'm having it from last 2 days.
Okay, and I understand, Olivia, and it's a really valid concern. I'll be addressing your all concerns, and together we'll formulate a safe and best plan for you. And in the end, I'll be giving you written information and also writing back to a GP. How does this sound?
That sounds well.
All right. Olivia, is this your first pregnancy?
Yeah, no, doctor, this is my second.
Okay, this is your second pregnant, and it was an unplanned one. How are you now happy with it? Am I right?
Yeah,
All right. And when was your last menstrual period?
it was, I think, 7 weeks back.
Okay, 7 weeks back. Yeah, that's fine. Can you tell me more about your disease, like condition, like you have an overactive thyroid problem? Any idea about that? And what medicine you're taking? You remember the name of that?
I think it's some methimazole
Okay,
something.
methimazole. All
Yeah.
right, all right.
Mm,
Yeah, yeah. Okay. And do you, at the present, as you told me, has stopped the medication, hasn't it?
yeah.
Okay, Olivia, we need to have consult your doctor. And are you in a, touch with him? Any, when was your last visit to your doctor?
It was a month back.
Okay, he's aware of your pregnancy or not?
Um, no.
All right, so we'll connect you to a doctor because, sometimes if stop the medication on your own, sometimes it can aggravate your problems and there can be some, aggravation of the symptoms, which will be difficult. Okay, so
Okay.
soon I'll be connecting you to for the same. And have you started your folic acid?
Yes, GP has given me.
All right, all right, okay. And do you feel any problem like excessive sickness or
Yeah, I feel sick.
okay, any medicines you're taking for the same?
Yeah, GP has given me some, but
All
the
right.
symptoms, yeah.
Okay. And do you have some symptom, like you told, you have a chest pounding, pounding sensation in your chest? And do you feel some problem with your water bowel habits?
Not yet.
Okay. Any sensitivity to heat? You have excessive.
Yes, yes, I feel like I sweat a lot.
Okay. Okay. Right. And can you tell me about your past pregnancy? How was that?
It was 3 years back. It was
Okay.
at that time also, I had a
Mm-hmm.
subtle this thyroid problem, right? Uh, for that, my blood pressure shooted up.
Okay.
Okay, and I had to. They terminated my pregnancy at 31 weeks. My baby was in ICU special unit for quite 6 weeks. She was an
Okay.
underweight baby. So that really, I'm really scared of that. That now also, if it can happen again.
Mm-hmm. I'm so sorry to hear about that. And how's the baby now?
Yeah, baby is doing well.
All right. And do you have any other medical illness of concern?
No, doctor.
Any drugs besides these? Any medicines you're taking?
No,
Okay. Any allergies?
no,
Okay. Any surgeries in the past?
no, doctor.
Okay. Are you aware of a weight to height ratio?
Um, yeah, this is 28.
All right. And blood group?
It's B positive.
Any reservations if ever required?
No.
Okay. And do you have any family history of concern, like similar condition in any family member?
Yeah, my mom and my aunt, they're also
Okay.
having this thyroid problem.
All right. And Olivia, can I ask you if do you smoke?
Um, yes, doctor, 4 to 5 cigarettes a day.
All right, Olivia, let me tell you, like cigarette smoking is not well for a general health also, and in your condition, it can aggravate. Do you think of ever stopping this? You have any idea about?
I really want to.
Really, I'll connect you to NHS Stop Smoking Services for the same. Is it okay?
Yep.
And what about alcohol?
Yes, sometime, occasionally.
Okay, Olivia, I advise you to stop this during this pregnancy if you want, and as this can have an effect on the baby also. Okay.
Okay.
All right. Any drugs for fun ever used?
No.
Okay. And how's your support at home?
Yeah, my partner is good. He's supportive.
Nice to hear. And Olivia, how you have been feeling during the past 2 weeks? Any low mood or something like that?
Yeah, it's okay.
Okay. And what do you do for a living?
Yeah, I work in a firm.
Okay. Thank you, Olivia, for sharing this information. Would you like anything else to add on?
No, doctor, my only concern is this that I'm having symptoms now. So
All right. All right. Okay.
shall I
Thank you for.
stop, keep on like till my appointment? Shall I wait till the appointment with my doctor, or I can take the medicines which I stopped already?
Yeah, I think what has happened. Like methimazole, we have two types of drugs for this. One is the propylthiouracil, another is the methimazole you're taking. So, as such, your symptoms, you can restart your medicine till we connect you to a doctor, or by connecting to him personally, I'll suggest another, or with a consultant, maybe we start you on another drug that's better, safer than this during the first, part of the pregnancy. Okay, I'll be
Okay,
speaking to my consultant. Yeah, regarding this.
okay, yeah, thanks.
Thank you so much. Thank you for sharing.
Yeah. Good. Okay,
Thank you.
yeah. So Bushra, take over. Yes. So let's start with the applied clinical knowledge management of this patient examination and management. Bushra, your mic is mute. Mic. Yeah.
Okay. Yeah, Mrs. Olivia, may I examine you in the presence of chaperone? My nurse will record your heartbeat and your blood pressure. And yeah, I would just like to see just overlook a few.
Yeah.
Okay.
Okay.
Yeah. And okay, Mrs. Olivia. I hope that you are aware of the condition, what the condition of having thyroid disease means to you.
Yes, doctor, I know it's
Okay.
some autoimmune problem and yeah, some proteins are there in me. I know
Yeah.
that.
Yeah.
Yeah.
Okay. So now, coming to your concerns, Olivia, a majority of the women with this condition, okay, have a straightforward pregnancy and do have healthy babies.
Okay.
But there are some risks. Yeah, there are some risks in the mother and the baby. Okay, the risk with the mother can be that there can be higher chance of blood pressure, and along with proteins in the urine, we call it as preeclampsia, or the delivery can happen before time. Okay, and as I'm aware that you already had a condition of the thyroid crisis, when the excessive hormones they can't cope up with your condition, and that time the gland becomes overactive. And I'm aware that you already face that. And if you don't want that to happen this time, I would really would want you that you take your medicines on time. Okay, stopping your drug is not good for you. It is the stopping the drug or the change of medication, and sometimes a bit of stress of labor or any infection may aggravate this condition. So I would really want you to restart whatever medication you were on, and I will connect you with the specialist doctor. And I know that some drugs need to be changed during pregnancy, but then he will look after that. Is that fine?
Yeah. Okay.
Yeah, and there are some risks to the baby, like we can have miscarriage, and the baby can grow small, and sometimes the baby can have underactive or overactive thyroid gland. Okay, and then about this condition, as you're aware that there are some antibodies which are stimulating your thyroid glands to produce more of hormones. So they even transmit to the baby, and because the same condition like excessive hormone production for the baby as well. So the baby can have an overactive thyroid gland. Okay, and there can be some side effects because of medications when we start. So usually in the first 3 months, we would start you on a medication which will be like a propylthiouracil. Okay, but this has some side effects on the liver function of the baby. So we would be stopping this drug once the first 3 months are over, and we would be putting you on a more safer drug, or we can put you back to methimazole. Okay, and however, these medications can have some side effects. Like they drop your blood counts. There are some protective cells which fight against infection. So these can really go down. So I would really want that if you have some fever or any infection, that you would come to hospital immediately. Am I
Okay.
clear?
Yeah.
Okay. Yeah. So your care will be under a multidisciplinary team. Your specialist doctor, our consultant, the specialist midwife, and the pain relief doctor. And at 36 weeks, you can have a plan for your birth and discuss the pain relief options. And it's better to deliver in a hospital in a consultant-led unit. And we will frequently monitor you and your baby. And after the delivery, we have to test the baby's thyroid function as well. And yeah, and and before discharge, we will review with the specialist doctor your medications, and after the delivery, we can discuss if you want to have some spacing regarding the contraception options, and you will continue to have a follow up with with your doctor. Okay, and one more thing regarding you need to continue folic acid, and I will start you on aspirin as well. And there will be, I'll ask for a booking blood test, and you'll have a down screening scan for the baby, and a mid pregnancy scan, and then a regular scan for the baby. Am I clear?
Yeah. Okay.
Are
So,
there
doctor,
any more
can I have
questions?
this time? This time, can I have the normal delivery? Like previously, I had a this cesarean section.
Yeah, there should not be any. We will monitor you majority of the time, 3 in 4 women who have a previous cesarean, if they do not have any problems, can deliver successfully vaginally. Okay, but I would want to know more in detail about where was the cut given as you had a delivery prior, like where the cut was given, and where I would like to review your notes also.
Okay.
And yeah, otherwise, majority of the times, if you develop any complications like blood pressure and all, then the scenario may change.
Okay.
Otherwise, if everything is fine, yeah, we would hope for a vaginal delivery.
Okay. Fine.
Okay. So I will give the information leaflet. I will connect you to the specialist doctor. You need to continue your medication. I'll write in your folic acid, and I'll also give appointment with the consultant if you have any further queries.
Mm.
And yeah, and I'll
Okay.
also write back to your GP as well.
Okay. Good.
Okay.
The best part of you girls are that you know how to speak, and most of the things are very clear to you, and I'm happy about it. That you are gathered, like you know that that's a question. If some question has come up, you have to reply in a very calm way, and that's the key. And you are dealing with it very nicely. So good, both of you, right? So let's move ahead. In the history part, the skin really did the justice. She made the agenda very well. She asked all the symptoms, right? And in maternal medicine cases, just keep in mind that in terms of drugs, you have to speak very less. And
Mm,
names, try to avoid. Try to
okay.
avoid taking any name. Okay. And try to focus on what she is saying. Don't try to focus upon yourself that what you want to tell.
Mhm.
Just that. That is maternal medicine. All right. She said that previously it was okay since past 1 year, but from last 1 month, I am having more symptoms. They have increased the dose. And the drug which she is taking, it is methimazole in higher dose, right? So the TOG which is there, and also in Catherine Nelson PSC, we can read hyperthyroidism from there only. They says that, um, methimazole and carbimazole, these are the two drugs which have least fetal this thing. They have this fetal malformation. The risk is very small. And what is the malformation? That aplasia cutis can be there, right? Um, in but it is safer for the mother. Okay, and another drug is propyl thiouracil, which has a better control, and it has even smaller risk of any congenital problem. It is safer for the baby, but it is
Yeah.
unsafe for the mother. It causes hepatic impairment,
Liver
right?
toxicity.
So we have to be judicial. So some of them says that, give propyl thiouracil in first trimester, give switch over to methimazole or carbimazole in the second and third trimester, right? So if she is on methimazole already and the disease is under control and drug is of maintenance dose, like between 5 to 15 milligram per day is the maintenance dose for methimazole. And if she is on like higher dose of methimazole, that's 20 to 40 mg per day, then you need to see that you can switch her on propyl thiouracil and for the first trimester, and then for second and third she can come back to methimazole. Okay.
Yeah.
So here what you have to do is you have to show your presence in the scenario. Okay. Just after taking the history thing, she has told you that methimazole I've taken in the higher dose. On that moment only, write down in your notepad with your pen. Write down methimazole higher dose. Symptoms worsened last month. Right? So this is the point you need to address, and that will show your situational awareness and patient safety and knowledge. Both things, 3 marks you will get for that. So, I mean, 3 domains you are covering in that one point. So mind those little things to be different from others. Okay. So you asked me when did you met your, and you have to, I wanted to ask Bushra that I have been advised the thyroid scan, you know. So you have to ask, did you get any radioactive treatment or any iodine treatment in the past, or any scans are due, any thyroid scans? So she'll say, yes, they have advised me. Or she will ask you that, I'm due for my scan, radioactive scan. So can I go for that? Because my symptoms are really getting worse and doctor need to see. Then you say, see, once you're pregnant, we do not advise it because it's harmful for the baby. It harms the thyroid gland of the baby as well. So we don't advise you that. Even after delivery, when you are breastfeeding, at that time, we stop the breastfeeding for some time and then we advise you to get the scan done, right? So like that, you have to explain the woman. And then LMP plan, unplanned contraception, uh, booking blood scans, previous pregnancy, mode of delivery, complication, disease, everything has been asked. Drug allergy, family history has been asked. Surgical, particularly you can ask about any neck surgery, any thyroid surgery for hyperthyroidism or goiter or anything. Smoke, alcohol, drugs, BMI, mental health, domestic violence. Examination, check the heart rate rather than saying the pulse, say heart rate. That's layman. Blood pressure, um, weight to height ratio, neck examination, booking blood scans and booking blood test and booking scan. Explain the grave. I hope you know that. Yeah, I know that it's an autoimmune problem. Yes, you're very right. Absolutely. So your body produces some proteins, right? So, and this protein overactivate your thyroid glands. It happens, this disease affects 2 in 1,000 pregnancies though. And the hormone which is produced by thyroid glands, it is basically your energy consuming hormone. It uses your energy. So your hands start shaking up, your energy being consumed, like heart started racing. So you feel tired. because your loss of energy happens. Medicines are the what medicines you're taking, they are generally safe. They have a very low risk of having any anomaly in the baby. But the doses, as you said, that you are taking higher doses, that we don't advise you. But stopping the medicine will harm the baby and you more than continuing the medicine. So I advise you strongly to continue the medicine till you find the appointment with the specialist doctor. And how I can help you in this, I will book the appointment now, and as early as possible you can meet the specialist doctor. Okay, I myself will help you in the way that I can expedite the things for you, or maybe I'll go and meet the doctor and we can discuss this thing together. So you can always go beyond your boundary also. Okay, like if suppose you are sitting in a multidisciplinary hospital, like hospital has all the departments, sometime you call, sometime you call, like I call my colleagues, like, I'm sending this patient to you, or this patient has come, I need you to see her as early as possible, or you give her the quick appointment, or I'm sending her to you, see her first. So you can say this, that I can call my colleague and to see you first, and I can book your appointment as early as possible, right?
Okay.
Maybe today they will see you and we are out of that dilemma, right? So just go out of your boundary. Do not keep any boundary. Cross that. And then doctor may change your medicine or may lower the dose and add some other medicine. Those will control your symptoms. That's we call propranolol, but you need not to know the name or get confused with the name. Let the specialist doctor take over and settle the medicines for you. And I will also be there to help in the selection of medicines which are safer for you. So we will do a joint meeting together as soon as possible for optimization of drug and dose. Till then, continue. Okay. So some effects that can be there in the pregnancy uh, for the mothers and the baby. But I want to reassure you, Bushra, you did that. And I'm happy. First sentence should be reassurance in all maternal medicine cases. Till the time it is the case where lethal anomaly or lethal, like the pulmonary hypertension case, Epstein anomaly, these are the things where we don't want to reassure. So we say that no, it's not going to happen, or you need to go for termination or something. So reassure that, this is like most of the women have a healthy baby and healthy pregnancy in when when overactive thyroid is there or Graves' disease is there. Uh, but sometime in some women who are pregnant, this condition can worsen in the first trimester. When you are pregnant, in the first trimester, it may worsen, and later on, the condition may improve suddenly. Because pregnancy suppresses the immunity, and this disease is related to that. No, so but after the birth of the baby, it can come back again and worsen again. So we advise you to get yourself your thyroid hormone testing done after the birth, after 2 months of the birth, to see that it is not coming back again, right? So the symptoms that can happen is like excessive nausea, vomiting. You can have weight loss despite of no loss of appetite. You may feel your weight is not increasing or even it is losing. Then there can be tremors, palpitation. The blood pressure may increase during the pregnancy. Urine can have proteins. Sometime that can lead to the symptoms altogether flares up so much, and that lead to a storm like condition, like a heart may fail. Woman's heart may fail. This condition needs hospitalization immediately. So that is something I need to warn you about, that if you feel that symptoms are growing or coming coming more frequently and aggressively, then you need to report immediately to the hospital. Okay. Sometime with the baby who's in the pregnant woman with this condition, the rate of miscarriage is a bit higher. Baby may grow small, may come early, right? Sometimes thyroid of the baby may also get these proteins from you, and thyroid may become overactive, or because of the drugs you're taking, thyroid may also become underactive. So both the conditions may happen. After the birth of the baby, we check the baby's blood to see what is the status of thyroid hormone. Your management will be altogether a team management. The you know your doctor, thyroid doctor, my consultant, specialist team of doctors, specialist nurse will be there, counselors will be there, your GP will be involved. You know, we all will be there to take care of you together. Um, you will be booked in consultant-led unit. Your visits will be frequent. Your drugs will be, doses will be maintained on the lowest possible dose later on, right? And your thyroid function test will be checked regularly by the thyroid doctor. Usually it's once in 1 month, and later on we may reduce the frequency as the disease come back to normal, or get suppressed when pregnancy advances. um, we start you on a small tablet, that's aspirin, to prevent the possibility of hypertension in future, and also the growth restriction of the baby. And we will start it from 12 weeks. The dose will be 75 milligrams, right? Serial scans will be offered to you for seeing the possibility of growth restriction in the baby. When you will come, we will make a plan for you in the later part of your pregnancy, like around 32 weeks. By the team, the whole team will sit down. Anesthetic doctor will also be there, and we will again titrate the doses of your medicine. That will be done by your thyroid doctor. And though if there will be no indication for a cesarean section, we will advise you to go for normal delivery. And once you will be in labor, you'll be hospitalized. Continuous monitoring of the fetal heart will be done. But as you have a previous cesarean, that too at a lesser period of pregnancy, that's preterm cesarean, sometimes the cut is being given differently. It's a different cut. So um, during labor, that poses an additional risk for giving way at the time of delivery. It may give way at the time of labor. So we, though we watch you, monitor you regularly, but I want to review your notes. As you said, Bushra, that was a perfect answer, that we will be, advising you at that time only, right? So there only. Okay. So need to see the notes and we'll discuss again. Anesthetic review will be done, and yeah, that same thing I have told you already. After the delivery, the disease may flare, you know, and symptoms may come back. So those crucial hours are there. So we shift you to the high density unit, or HDU. That's the whole team of intensivists are there to take care of you, and specialist people. Breastfeeding is safe. Medicines are safer in breastfeeding. They cross very little in the breast milk, but still we will advise you to have split doses of the medicines and feed the baby after an hour or so after taking the dose, or take the dose after breastfeeding. And we will be, for the scanning which is due for you, you can get it done after your delivery if your symptoms will be uncontrolled, or your doctor will demand it. So I will be giving you written information. I've told you that while making agenda, you can tell all these last minute things in prior. While making agenda, you can put these things, in the end, I'll be giving you written information, and write to your GP and do the documentation. I am booking your next appointment. That will be our joint meeting. Your partner may also join, and your GP will also be there. My consultant will be there. Your thyroid doctor will be there, and we will discuss this, the possibility of managing you in your pregnancy in a best way again. How does that sound to you? And now I'm giving you feedback, so I'm talking in a flow. But when you talk to the patient, you after every 2-3 lines, you should stop and say, "Is that fine?" Because they will be unknown to you, and you are giving an exam. You have to make a good bonding with them. look into their eyes, make a contact with them, eye contact, and be very confident and show them you are very empathetic and listening to them. Just speak, have non-verbal communication also, like keep on nodding your head that okay, I see, okay, can I write this? Yeah, I'll write this. Okay, I'll address this also. Okay, yeah. So like that you have to keep on listening very actively. Okay. So Taskeen, your communication skills, which I saw now, they were very beautiful, and I'm really impressed with both of you. You both are very good. So, but just keep on practicing quickly, 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 and just now load your brain with all type of scenarios. So at least 7, 8 stations you need to do in a day. If you have a study buddy, it's okay. Otherwise, talk to yourself. Record your voice. Listen to that. Initially, you will feel pathetic. That how the hell can I hear my own voice and this? But that will give you immense confidence. Believe me. Okay.
Yeah,
Some
ma'am.
people don't get a study partner until your exams. My study partner was Bushra. We had a very good bonding, and we still have. We are still carrying that bond. Yeah. So she was also Bushra, and we cleared it together. We had the same percentage. I got
Mm.
75%.
Nice.
I got 74%. She got 75%. So almost parallel we landed up, and we were the study buddies. We used to do 10 to 12 cases in a day with our children roaming around and troubling us. But we managed anyhow, and we cleared in one go. So I will advise you just to keep on practicing. Do not stop speaking and thinking. Speak in your mind also. Okay. We all are stuck in our daily routines also. So just keep on speaking, keep on doing. Okay. So my way of living is either you run the day or the day runs you. So you have to run your day. You have to
Yeah.
keep on going. Don't plan too much. Like today I will do this, and by this date I will finish this. No, this doesn't happen like this. In real life, you have to take the things as in they are coming. Some days will be busy. You will not be able to, complete your syllabus, but that hardly matters. You will cover up next day, or maybe it will remain pending forever. That's also okay. When you know something by heart in your brain, that's enough. All right. So
Mhm.
just keep on reading, keep on revising, make your own templates, own handwritten things, own circles, own graphs, own charts. Don't rely upon anyone. Okay,
Mm.
Okay.
that's all. So we end
Mm.
the meeting here. I will send the recording. Maybe
Okay.
in the group, or maybe I will not send because